weeks we screen, and we especially screen the Black women because we recognize that diabetes is a significant higher risk in Black women compared to any other race that we see here. Yes, you may talk about certain types of, Indian, but because we have majority of Black women, we know that that risk is increasing in Black women. So that's a big risk. So we screen women in pregnancy, and at the point we're probably now into screening all Black women in pregnancy for diabetes. There are additional risk factors like the women who are overweight, women who has a mother, father, sisters, brothers who are diabetic, women who had a baby before that's quite large, or women who had diabetes in their previous pregnancy because it has a recurrence. So we have now, so even if we don't talk about the women who come into pregnancy diabetic, we're now picking up women who develop gestational diabetes during pregnancy, and some of them continue to have diabetes after. So we also picking up those younger women in pregnancy as well.
So you're saying well, let's clarify this. I'm going to ask the question: do the women that you screen and find to have gestational diabetes, does that condition stay with them, or is it something that can be controlled and go back to normal post-pregnancy? Is diet a factor here once you screen and pick up gestational diabetes? What can you tell us about that?
Right. So most of them will disappear by the end of pregnancy because it's a condition related to, yes, risk factors, but also the placental changes. So once the placenta is delivered, most women would resolve. But we know that there is somewhere between 1% and 5% of women will go on to have chronic diabetes. So what we typically should do is screen them again 12 weeks after pregnancy when we know all the pregnancy hormones are gone. So we know now it can't be pregnancy related. So if we screen them at 12 weeks, 6 to 12 weeks, and we recognize, well, you're still showing a high blood sugar, then we know that these are women that we were chronic diabetic and we picked up during pregnancy. So these weren't straightforward gestational diabetes. But gestational diabetes itself is also a risk factor for diabetes later on in life. So there is probably some role for screening women who had gestational diabetes every 1 to 2 years until as they continue on in life just to see if they have developed chronic diabetes later on in life.
Well, we've spoken about diabetes and pregnancy, but there are several other areas where diabetes can affect a woman's health. So can you share some of those ideas and positions with us?
Okay. So even in young women, even without being pregnant, we know that diabetes is associated with a higher risk of infections. So they're more likely to get increased amount of urinary tract infections, so of the bladder, of the kidney. And the symptoms of those are usually things like burning when you pass urine or pain in your tummy when you pass urine, passing water more often than your custom. I know in some diabetics, that's one of the signs that they have for just being diabetic. But they might find that they pass water more often, is painful, and they may notice a change in color. So in that case, we will need to treat them for the urinary tract infection. But then you may also need to see, does her blood sugar needs to be better controlled? And that's the reason why she's at higher risk. So then we get the diabetes specialist involved. The other infection that's particularly common in women with diabetes who are not well controlled is yeast infections. So typical yeast infection, a woman will have a thick white discharge, no odor, pretty itchy, or the vagina is very irritated. And some women that have their first of diabetes because they're having recurrent yeast infections that they're treating, it's coming back, they're treating, it's coming back. And some of those women, when you test them, they're actually diabetic. So treating the diabetes and reducing the blood sugars to normal level can actually reduce the amount of yeast infections that they have. Outside of that, say during sex. So women with diabetes can have complications with sex. They may find that they have a reduced desire to have sex, which is more painful because the vagina can get drier. they may not be as pleasurable because they can have nerve damage, like anywhere else in the body with diabetes with nerve injury. You can have nerve damage in the vagina, so they may not be as enjoyable. And there is sometimes reduced blood flow, so they might find sex as not as enjoyable, and sometimes can be more painful. Again, if they're early diabetic, we may be able to control that with blood sugars, but as time go on and it's actually a nerve damage, you might find that that may not be as easily reversible as we would like to.
Okay. So
And that can also happen. Yeah. Go
okay.
ahead. Sorry.
No, it's all right. I was just going to say, so how much more complicated does this get than when a woman is going through menopause or is premenopausal? Is that an additional concern?
For sure. So, I mean, menopause itself, by the fact that your estrogen levels are falling, you naturally do have a reduced libido. You can have vaginal dryness because the secretions are reduced, and the moisture is reduced. So that may actually help to compound those factors if they were present before that time. So you might have women who are in menopause may find that they need to be using more lubrication to help them. You can try to control the blood pressure to see if that does help them a little bit. But then other than that, you may have to bring in discussion about using some form of hormone replacement. And that's not specific for diabetic women. That can happen to any woman at all. But then with diabetes, of course, it may worsen what is already there before.
Mm-hmm.
So we have some calls, some messages, I believe, some WhatsApp messages or questions.
So
this one says they want to know whether metformin is safe for pregnancy. You need to explain what metformin is and then answer that question.
So metformin is a drug that we use predominantly in diabetes, but we can also use it in a condition called, in a gynecological condition called polycystic ovarian syndrome. So it affects the insulin levels. So it is one of the only oral medications that is used to control diabetes in pregnancy. Because outside of metformin, at present, all we have is insulin. So on metformin before and well controlled, they can actually continue with metformin during pregnancy. If we switch to from another anti-diabetic medication, we usually switch to metformin unless we switch into insulin. And then for women who develop diabetes during pregnancy, metformin is usually the first line drug that.
Okay. All right, let's keep those questions going. It says, my toes are, well, that's supposed to be tingling. I've lost a bunch of weight. How concerned should I be? You smile.
I smile because that's not in my realm as a gynecologist.
That's more the podiatrist?
That's more the diabetologist, your general practitioner. But I think so. I think definitely that's it may not be diabetes, it may be, but those are some of the symptoms. So it's best if you get that checked as soon as possible. Because the other thing is that we need to be recognized is that if we identify something early, we can do modification, whether it be lifestyle modification with diet and exercise, because that's still the hallmark, or whether we induce medication. The earlier we catch a disease in the disease process, of course, the better it is for everyone, because there's a less risk of long-term injury to the heart, lungs, limbs, nerves. So, once you're concerned, and I always say, as soon as you're concerned, you see your doctor.
I want you to say a little more about the point you brought up earlier regarding women's sexual health and how diabetes can impact vaginal conditions. And you spoke about nerve damage. What are some of these signs that this is happening? Because if women are going through this, they may also be concerned or embarrassed or wonder what's wrong and may not want to share. So what exactly would they be experiencing if this has happened to them possibly?
So one of the major ones is loss of sexual desire. As a gynecologist, I come across so many women that, once they get a certain age, they get responsibilities, life comes in the picture, their sexual desire is not the same as it was before, as the same as their partner. That may not only be due to diabetes, that may be due to other things involved. We always try to break down and say, is this something else going on? Is life something going on? Your children, life, husband, partner. So we try to break down as much as possible, but that happens to any woman, and that can also happen to the particularly disregard this. And I think, for a healthy relationship to survive, we also need to sex needs to be involved. Maybe not need, sex should be involved, right? And if you get to a point where your libido is falling, your husband's or partner's is still the same, then it's something that affects your relationship, then you should seek help and talk to somebody.
And together.
And together.
Right.
You might want to talk at first and then together, but you should seek some sort of help. And that's for every woman, whether you have a chronic illness or not, that's for everyone. Because it does affect your relationship. But especially for diabetic women, even before menopause, they may know vaginal dryness. And they may get loss of sensation during sex, or maybe even tingling as a nerve during sex. So once you're starting to experience that, then of course you need to check. Is my blood sugar is well controlled? Do I need to talk to my diabetologist and the gynecologist, of course, because there may be other reasons, to see if this is something that is happening to me because I'm diabetic and I need to better control my blood sugars, or if there's something else going on. Because there are lots of other reasons why these symptoms can occur, not only with diabetes, but particularly in diabetes.
In your particular area of specialty, how do you proceed to advise them to take better care of self? Because that's a major part of why we're here this evening, to give people tips on prevention and better maintenance of self.
Well, that's hard, and one of the things I always find when we have any discussions with women, it's part of, they come for routine pap smear or they will a woman visit, we check their blood pressure, you may check their weight, so we get into discussion about how can you have a healthy lifestyle and maintain a healthy lifestyle. We add that with their dietitian, with their general practitioner. But depends on where they are along their reproductive age, then the conversation varies a little bit. If they want to get pregnant in the future, think about pregnancy, or even don't think about it, and I'm telling them, well, it likely would happen. We try to say, well, we want to keep you as well controlled as possible. If they're not diabetic and they're overweight, we try to explain the benefits of having as close to normal weight during pregnancy and the risk of obesity in pregnancy. If they're diabetic especially, I try to talk to them about being as well controlled as possible. And if they're not well controlled, and if not trying to get pregnant, then we introduce the talk of contraception as well. Because you don't want to I prefer my women who have chronic disease to plan a pregnancy as much as possible. Yes, it's not always possible, but planning. Yeah.
Yes, planning is key. And we'll pick up from that point, but we do have to pause here for lotteries. Your Health, Your Action will continue in a few minutes.
Hello?
Hi, Grace, me.
Hey, Cheryl. Girl, I can't talk to you right now. I'm doing my morning exercise.
Babe, since when is your morning exercise so important?
Since the World Health Organization say that people with NCDs are more likely to get real sick if they catch COVID-19.
What?
Yes, I'm a diabetic. Plus, I put on a little size. So I got to exercise and use up this little bit of energy that I got to keep my blood sugar under control. Plus, my doctor says that when I exercise, it will help to keep my immune system strong.
Oh, so God forbid, if you ever get COVID, you have a better chance of recovering faster.
Exactly.
Grace, I never told you that I have high blood pressure. I don't even take the medication properly. I looking got to join you in your morning soccer size or the line dancing. What do you think?
Yes, and I can send you the same routine that I'm doing here now, girl. It's real sweet.
Hon, I know you like your rice and pork, but I wish you would eat more vegetables.
Sweetheart, why do you worry so much about what I eat?
I worry because you have high blood pressure and high cholesterol. The World Health Organization says that people with NCDs are more likely to become severely ill if they get COVID-19.
What?
And now that you're only working 3 days a week, you're spending more time on the sofa, watching TV, drinking soft drinks.
So how is eating like that going to help me? These times are so stressful. Just let me enjoy myself.
Vegetables are high in vitamins, minerals, and fiber to help maintain your weight and control your blood pressure. A healthy diet helps to keep your immune system strong and protect you from diseases.
I know you really care about my health, hon, and I really appreciate it. Look, I'm going to have some vegetables. Can I have a glass of water, please?
Wait, you wash your hands?
Hello?
Hi, Grace me.
Hey, Cheryl. Girl, I can't talk to you right now. I'm doing my morning exercise.
Babe. Since when is your morning exercise so important?
Since the World Health Organization say that people with NCDs are more likely to get real sick if they catch COVID-19.
What?
Yes, you know I'm a diabetic. Plus I put on a little size. So I got to exercise and use up this little bit of energy that I got to keep my blood sugar under control. Plus my doctor said that when I exercise, it will help to keep my immune system strong.
Oh, so God forbid, if you ever get COVID, you have a better chance of recovering faster.
Exactly.
Grace, I never told you that I have high blood pressure. I don't even take the medication properly. I looking got to join you in your morning soccer size or the line dancing. What do you think?
Yes, and I can send you the same routine that I'm doing here now, girl. It's real sweet.
Thank you for joining us on Your Health, Your Action. Remember, this evening we have been focusing on complications of diabetes with special emphasis on women's reproductive and sexual health. You've heard a number of perspectives from Dr. Tracy Archer, obstetrician and gynecologist. She's spending the next half hour with us on this week's program. David, so many interesting points coming out, so many areas that we're realizing. This again is not a one-person approach. It's far-reaching and it can impact families.
Yes, and there are a lot of men who sometimes see that the women are going through changes but cannot understand what it is all about. So this whole question of communication, Dr. Archer, is crucial.
Definitely.
And I have a question here as to what puts me at risk as a woman, what puts a woman at risk of gestational diabetes?
Right. So being overweight is one of the major ones. If your mother, your father, your sister, brother, so first degree relative, have diabetes, then that puts you at higher risk as well. If you had a previous baby that was large, so we say more than like 4.5 kilograms, I'm not sure, that's like 9+ pounds, that also puts you at a higher risk of diabetes. And just unfortunately, just being a black woman also puts you at higher risk of diabetes. So those are the major risk factors. I mean, there are other things that happen during pregnancy, but those are the risk factors that you come into pregnancy where we think, well, yeah,
Yeah.
she needs to be screened or looked at. Yeah.
So, what do you say to a woman, a female who has come to you and presented possibly with gestational diabetes? I know you talked about the metformin and how that is given, or insulin if someone is diabetic, but how do you treat them? Can just changing the diet be a measure to help as well?
Definitely. So we start with, well, explaining to them what's going on, why they have, what their blood sugar levels are like. Um, so at home, they go home with a machine and they measure their blood sugar, and that allows me to determine how we need to be treated, along with involvement of a dietitian. So we ask them to modify their diet and use I mean, broadly, less sugary stuff.
Mm-hmm.
Um, so unusual modification of diet and probably with some exercise. We encourage exercise from early in pregnancy, but especially in
Mm-hmm.
your exercise, because in pregnancy we recommend the same as when you're not pregnant, 30 minutes, 5 days a week of moderate intensity exercise. And moderate intensity for us means that while you're exercising, while you're actually doing the movement, that you can still talk, right? So
Okay.
that and exercise is usually the first line treatment that we try. And if with that, then we cannot get you control with just modifying your diet, because most women are will be will want to, because you want to be out the best for your baby. If you ask them to do it for themselves, they might not be as motivated as we say, well, if you do this, then your baby have a better outcome. So then most women will be motivated enough to change their diet. And we usually get pretty little control with diet alone. And it's only if your diet is not well controlled, then us in conjunction with diabetologists, then you may add the metformin or insulin depending on the severity.
I'll share with you guys quickly. When I was pregnant, I experienced slightly elevated blood sugars, and I had to, write everything down. So you had to. It was like a whole journal. It was very clear. What you had to have for breakfast, lunch. You had to write everything you would normally eat, and then write everything you actually ate. Water was the drink, water, and if you had a hot beverage, no sugar. And I've become so used to that. I just stuck with most of the things I learned from that. But I think that generally we as a people, we have this habit of eating very rich foods and putting a whole bunch of things together. Like that taught me you cannot have a malt and then have bread and then some other kind of starch, because that is intense sugar right there. So like hopefully people will take note of those little things.
Well,
But the other thing,
sorry, very, very prevalent these days is the recommendation of intermittent fasting.
Fasting, yes.
Now,
It's trending.
when your patients come to you, pregnant on the one hand, and those who are not pregnant, how do you speak to them about that?
I still recommend, and we do this with everything, I still recommend that if you have a healthy diet, breakfast, lunch, dinner, then you're going to be fine in pregnancy. There are some articles about intermittent fasting in pregnancy and how you can do it. And I think there may be 1 or 2 studies talking about the safety of intermittent fasting in pregnancy. In that case, I usually do not recommend it unless they're actually using it and it's worked for them and that's something they're doing all the time and they're comfortable doing it. But I usually don't I personally, I usually don't recommend it in pregnancy, and then I usually will get the dietitian involved. But You know, it's that's one of those topics. It's one of those,
Open.
I find with diets, they come and they go, and then they're good one minute and they're not so good the other minute. So it's one of those things. Yeah.
You mentioned the exercise as well, but I'm just taking a moment to say to persons, of course, all of this has to be done with the guidance of your OBGYN, because every pregnancy is different, and so women may have to be on the bed quite a bit and not be able to do that. And then there will be women who they were exercising hard before, so they can still continue to go through their whole aerobics workout. So you just have to be very aware of what your immediate circumstance is. But for you to say a little more, you need to say a little more about the sexual health issue, because it is real and clearly affecting, it has to be affecting more people than maybe we know, since these NCDs are affecting our population so much.
I'm particularly curious about
yes.
the issue of diabetes and menstrual cycle, because as I understand it, it does have an impact there as well.
On the menstrual cycle?
Yeah.
It can. It can. Not so much women who are well controlled or even a little bit out of control. But what we have been finding is that the menstrual cycle can actually affect the blood sugar.
Oh.
So the changes in the hormone throughout the month. So some women might find that their requirements may increase or decrease just before or after the blood sugar, even after the period. So it's just a matter of monitoring your blood sugars during that time, and then talking to the diabetologist and see, well, look, I may have to increase or decrease my amount of insulin medication depending on certain types of the times during their whole menstrual cycle, starting from between one period to the next period. So we still find women with diabetes will more or less still have a period. But the main fact may be that the period may impact on their blood sugars itself.
Okay, so Dr. Archer, what is the treatment for this vaginal dryness as we talk sexual health? Is it okras, or is it a tablet, or is it, something else, something over the counter?
So it can be over the counter, just as easy as buying some lubrication over the counter. Widely sold pharmacies, supermarkets, wherever you will find a lubrication, and it's used for sex. So once you're about to have sex, you say you insert it in the vagina, or if you're not comfortable, then the man can put it onto the penis, and so it advances with him as he goes into the canal.
What
So
should you
usually
look for
dryness,
though,
and
so that you buy something that is the right, that has safe ingredients? I'm not asking about a brand.
So many out there.
I'm not asking about a brand. I'm asking, we often hear about certain ingredients. When it comes to hair shampoo, you hear about parabens and those things that aren't good. So I'm asking, is there something that you should look for so you're comfortable that it is safe for your pH balance?
Right. Not really.
Okay.
And it depends, and it's not really in a general sense, but each woman is different, because there are some women who nothing at all can touch their vagina other than water. Other than that, they get very irritated. And there are natural water-based lubricants out there for them. And then there are other lubricants that have flavors and tingling sensations, and so different women may find different things work for them, and it's just what works for you and what works for both of you as a couple, and what improves your sexual experience. And that's the most important thing.
Cassandra?
Use it as a method of lubricate or foreplay, use it method of play. So it's what works for to enhance your sexual experience, and that's usually wise.
You're going to say
that
something,
like
David?
Water-based ones.
Yeah.
They look good to me.
You were going to speak about water-based ones?
No, some men like the water-based one, but they dry out quite quickly, so you have to
dear.
remember that. And some men like the ones that are silkier, but they last a little longer. So it all depends on
but in all of
how
this,
long you're having sex.
in all of this, you also have to take into consideration what the man likes.
And what I'm saying, for both of you, what improves the sexual things for both of you.
So we have a caller on the line.
Okay, let's
Good
take that
evening.
call before I ask my next question. Good evening, welcome. Good evening. You're listening and watching Your Health, Your Action. Do you have a question?
Hello, good evening.
Go ahead.
Yeah, I would
All
like
right,
to
good
know.
evening.
I would like to know what is the difference between insulin and medication for diabetes, and I would like to know if the insulin were a lot more faster
You mean than a
than the
tablet
tablet.
form of medication?
Yeah.
Okay, Dr. Archard?
I can give you very basic understand by thing. The tablet forms, all right, so you have two forms. You have the insulin and the tablet forms. Um, I would have to relate to my field. If we have diabetes right uncontrolled and we want to quickly control it, we tend to go with insulin over tablets because, of course, the insulin will work a little bit faster. And we can better control. We can actually adjust the dose a lot easier and quicker response. So that is in relation to pregnancy, and I'm assuming it's outside of pregnancy. It's going to be similar thing, but the insulin works a little bit faster. And yes, but there are some people who obviously don't want to stick themselves because the insulin is going to be made like 3 times a day or twice a day. So sometimes tablets will work a little better for them as well. So it's a matter of patient choice and also the severity of the insulin and any other additional factors.
Okay, we have a WhatsApp question. So let's see what that one says.
Can diabetes be successfully reversed? Can it be successly reversed?
So unfortunately, I can't speak. I can't speak to that one at all.
At all?
All I can tell you about is diabetes during pregnancy. I mean, I'm sure there've been some studies done. I know there was a reversal study done in Barbados, but I'm not sure of if it's been completed or if it's been published results as well. Yeah.
There's a question here about diabetes and incontinence in males and females, but I'd like you to look specifically at the female. Is that a major challenge?
I do not. For far we see, it's not necessarily a major challenge. If of course if you have severe nerve damage and the bladder cannot function as well as it needs to, then definitely you can get incontinence. So that has to be a lot more of an end organ long-term complication of diabetes when damage bladder and to the pelvic floor, so that the ability to maintain the strength to the bladder neck is compromised, so you can get incontinence.
So basically what I'm hearing here is that as black people, and in particular black women in a country such as this, we are more predisposed to having diabetes than other races. And in those circumstances, it therefore means that all like now, you have to be paying particular attention to the issues such as diet, exercise, and also those frequent visits to the doctor to establish what's happening with you.
Yes.
Definitely. That's the key. The key is a healthy lifestyle as much as possible. We're not saying that it is an easy thing to do, but I think it's a necessary thing to do. So we have to get moving and keep moving and make movement a part of our daily life and make it enjoyable as we go along, because we don't want it to be a chore. It's something that we need to do for the rest of your life. So as healthy a lifestyle as possible, because we're realizing more and more. Pardon me?
You say we are realizing more and more
that the widespread or the effect of diabetes, obesity on all of our as a female, and the entire reproductive health.
Now, from where you sit, how long have you been in practice overall here? And from that experience, how have you seen it change one way or the other?
So I've been a gynecologist for about 20 years, private practice for about 10. My first maybe 10 years was in a different environment with not so many black folks. So having to come back to Barbados, and I think about 10, 15 years ago, there was a big a lot of work done on obesity in women and how it relates to our reproductive health. And we've always had obesity. That's not something we've not had before. But I think we are getting more and more evidence of the impact on obesity on lifestyle, on finances, on government. We're recognizing it more and more. So because more attention is now being paid to it, so we are now trying to do a lot more work. But we've always had obesity as a pandemic for I would say as long as I've been a student. We've always had that. But just that now, over the last few years, I would say probably 10 years, good, well, that we've put more into managing it, patient awareness, maybe even doctor awareness as well. And we're finally recognizing the impact it's having on our healthcare system.
Yeah. All right, we're going to pause here. We'll take a quick break. You're watching Your Health, Your Action. We'll be right back.
Hello?
Hi, Grace Me.
Hey, Cheryl. Girl, I can't talk to you right now. I'm doing my morning exercise.
Babe. Since when is your morning exercise so important?
Since the World Health Organization say that people with NCDs are more likely to get real sick if they catch COVID-19.
What?
Yes, you know I'm a diabetic. Plus I put on a little size. So I got to exercise and use up this little bit of energy that I got to keep my blood sugar under control. Plus my doctor said that when I exercise, it will help to keep my immune system strong.
Oh, so God forbid, if you ever get COVID, you have a better chance of recovering faster.
Exactly.
Grace, I never told you that I have high blood pressure. I don't even take the medication properly. I look at that.
Welcome back. The question is, the thing is, we always have so many questions and always so little time, so we're going to try and maximize this. You still have an opportunity to get in some questions. You can call us at 228-5562 or 228-5563. You can also send your questions via WhatsApp if you would like us to ask them to our specialist this evening, Dr. Tracy Archer. She is an obstetrician and gynecologist. You said so many things about you know, the woman's reproductive system and, you know, woman's health and being healthy and staying on top of things. You also talked about the bladder and how that can be impacted. So is there anything else? Should women be looking for change in terms of smell of urine? Does it look different? Apart from the color, does it get cloudy? What else can you tell us in terms of what to look for and that people should not be afraid to look into that toilet bowl once they've done the do? Okay, so we're not hearing you, Dr. Archer, so you may have muted yourself. You don't need to. Go ahead.
For urinary tract infections, majority of the time they're going to be aware of some pain, majority of the times. A difference in the odor. So if you notice a difference in the odor of the urine, then that you may need to monitor that. Vaginal discharge, we see a change in the vaginal discharge or a change in the odor of the vaginal discharge. That's normal as well. What I do not want women to do is to try to wash inside their vagina, trying to think, well, something is there, we just try to wash it out from inside the vagina. When I mean inside, is that your fingers are advancing into the vaginal canal itself. You don't need to wash your vagina. Your vagina has a natural cleansing system itself, your secretions and a discharge. That's what that's there for. So washing does not prevent you from having a change in discharge. Washing does not odor. It actually can make it worse. So those are the general things we look at vaginally. Sometimes in diabetic women, because generally any cuts or bruisings that they get, that it may be slow to heal. So if they use a razor and they get and nick the vaginal the vulval tissue licks or the vulva, just make sure that it's healing properly and keep an eye on it and make sure that it's healing well, because you can have delay or slow healing in women who are diabetic. But yeah, that's usually what you look for the vagina.
But what about the psychological impact on women that you see who realize that diabetes is changing important aspects of their life?
Yeah, yeah. Um, what part of the counseling with women from diagnosis or whenever you meet them is you explain to them the progression of disease, how they can manage it, how they can make it better. We try to see how they're feeling about their diagnosis, how they're managing the disease process as well. Because most women with any long-term, any complication or any problem that they need long-term management or long-term medication, that can take a lot of out of them, both physically and mentally. So the whole idea is to get them as early as possible, get the family involved to help them with managing the diabetes. If they need to, get some psychologists involved as well, or even support, because even knowing that you are with a group of women or know other women that are experiencing the same thing, that can also help as well. So especially what I've been doing is trying to get my women that I know that have diabetes long term or new diagnosis. There are the Diabetes Association and Diabetes Foundation that usually have quite good support. They can have group sessions with other women, so they know that they're not in this alone and that they have the support they need, whether it's at home or whether it's a
Yeah.
group of women that are like-minded women, or even getting the help of a psychologist to help them to manage.
I
Yeah.
have another question here on this question of how safe is douching?
Oh. Ooh.
I would prefer people not to douche. Please do not douche. So what douching does is a vagina is not sterile, right? It hasn't good bacteria. It needs to be there. It maintains the normal environment, normal pH. It keeps the
Dr.
vagina
Archer,
ticking.
please just repeat what
Yes,
you
please.
said from the beginning there, the response to David, because the internet sometimes comes and goes. So just repeat that.
Right. Okay. So what I'm saying about douching, that one?
Yes.
Yes. Okay. So I would prefer women not to douche. Your vagina is not sterile. It hasn't bacteria that maintains the normal environment. It keeps the vagina healthy. You will normally see a discharge. That's part of the secretions from the vagina and the glands. When you douche, you're removing your natural bacteria. So you're exposing your vagina to overgrowth of abnormal bacteria. You have the classic things like yeast infections. You may get bacterial vaginosis, which is usually a white to a yellow discharge that gives a fishy odor. So what you're doing is changing up that natural environment and exposing you to overgrowth of abnormal bacteria, which then gives you those symptoms and give you the vaginal discharges that are not normal.
Okay. I think that, David, what I'm going to do is sometime we're going to have the dietitian talk about things that are good for the diet, foods that are good for vaginal health, because Dr. Archer here did not answer me about the okras. So I'm going to ask that.
Intentionally.
We're going to pause though and then come back and wrap up in a matter of moments. Stay with us.
Han, I know you like your rice and pork, but I wish you would eat more vegetables.
Sweetheart, why do you worry so much about what I eat?
I worry because you have high blood pressure and high cholesterol. The World Health Organization says that people with NCDs are more likely to become severely ill if they get COVID-19.
What?
And now that you're only working 3 days a week, you're spending more time on the sofa, watching TV, drinking soft drinks.
So how is eating like that going to help me? These times are so stressful. Just let me enjoy myself.
Vegetables are high in vitamins, minerals, and fiber to help maintain your weight and control your blood pressure. A healthy diet helps to keep your immune system strong and protect you from diseases.
I know you really care about my health, Han, and I really appreciate it. Look, I'm going to have some vegetables. Can I have a glass of water, please?
Wait, you wash your hands?
Hello?
Hi, Grace Me.
Hey, Cheryl.
Girl, I can't talk to you right now. I'm doing my morning exercise.
Since when is your morning exercise so important?
Since the World Health Organization say that people with NCDs are more likely to get real sick if they catch COVID-19.
What?
Yes, you know I'm a diabetic. Plus
To you, Dr. Archer, your quick final thoughts on this particularly important subject of women's health and diabetes.
So my quick thoughts. So my quick thoughts are: be healthy. Generally, all women, be healthy. Have a healthy lifestyle, healthy diet, exercise as part of your usual routine as much as possible. And if you are diabetic and you are considering pregnancy, let's have a discussion first with any of us obstetrician, so we can plan for you to have a better outcome for both you and your baby.
Thank you very much. And you know, we've been talking a lot, Cassandra, about doing things the right way.
Yes.
There are a lot of people, when it comes to eating and looking after their nutrition, they just don't have a clue. So what we're going to do on the next program, we're working on that right now, is to go somewhere like a supermarket and walk through the aisle.
Show you what you should buy.
And we are going to do our best to help guide you in this particular direction. And one reminder that if you join this program late, or if somebody has to tell you about it or you want to see it again, go to YouTube, just put in a search for Your Health, Your Action,
Yes.
and you're going to see all of these programs that have come so far. Good night.
Good night.